Holistic observation as a method for behavioral assessment is intimately linked with cognitive behavioral therapy, or CBT. With naturalistic observation, a problem behavior is identified and then recorded whenever it occurs. When this is done, usually with the assumption that the behavior is the problem as opposed to the behavior being indicative of a problem. Once enough data is collected on the frequency, setting, and duration, etc., a clinician can decide the right course of intervention, usually some form of CBT. This is because cognitive behavioral therapy aims to reform patients' cognitions and behaviors so that they may live a more healthy life. OCD gives a very good opportunity to see both the assessment method and the intervention put to use. In a 2013 study, researchers listed below used a naturalistic observation to learn about a family's effect on a patient's OCD. Every 3 months for a year, they assessed 94 patients for symptom severity, family accommodation of symptoms, family emotional expression, and family burden. They found that higher rates of family accommodation and emotional expression were linked to higher severity of symptoms in the patients. These findings would be incredibly important to a clinician because they would be able to recognize that the family may have a very active role in contributing to the undesirable behaviors observed and can include them in the treatment process. A very viable next step would be CBFT, where cognitive behavioral therapy is modified to be more family-oriented. In a 2007 study, researchers listed below again intended to find out how effective cognitive behavioral therapy was. They had 24 subjects in the individual CBFT group, 29 in the group condition, and 24 in the control. They were all ages 7 to 17, and their family members were tested on the same plethora of metrics as the patients where possible. They had an initial, a 3-month, and a 6-month follow-up. In both studies, they found that CBFT was effective in reducing symptom severity, sibling depression levels, and was also effective in reducing family accommodation through education in the group condition. In both studies, naturalistic observation was used to gain understanding of the experience of the patient and the people around them who were of importance. The second article effectively builds off of the information from the first by sharing how findings from naturalistic observation can influence the kind of CBT required for the patient. Looking at these two subjects, we can apply similar concepts to different cases by focusing on the naturalistic observation of both the patient and the people surrounding them, and tailor a CBT to the group based on their interaction.